Hello, my name is Mark Nordenberg. I'm the former chancellor of the University of Pittsburgh and currently serve as chair of its Institute of Politics and director of its Dick Thornburg Forum for Law and Public Policy. It is my privilege to welcome you to this Governing in Crisis series that is being co-sponsored by the Institute and the Forum. And it is a particular pleasure to welcome Bobbi Watt Geer, the president and CEO of the United Way of Southwestern Pennsylvania, as our special guest. Bobbi is a native of this region. It gives me particular pride to say that she earned 2 degrees, an undergraduate degree in communication and a PhD in public policy and public administration from the University of Pittsburgh, in addition to earning a master's degree in nonprofit management from Robert Morris University. Her very first job was as a laborer for Allegheny Ludlam in Leechburg. I'm sure she made distinctive contributions in that role, but to our good fortune, for more than 3 decades, she has been a force for good within this region's nonprofit sector. Among the leadership positions she has held are Senior Vice President for Administration of the United Way of Southwestern Pennsylvania, President and CEO of the United Way of Westmoreland County, which also served Fayette County and a portion of Armstrong County, and President of the Community Foundation of Westmoreland County. Bobbi, welcome. And now that I've had a chance to briefly introduce you, perhaps I should give you a chance to briefly introduce the United Way of Southwestern Pennsylvania.
Well, thank you so much for that introduction, Mark, and it's a pleasure to be with you. You know, United Way is a global organization that's been around for 136 plus years, but here in the Pittsburgh region, we've been around for almost 100 years, and United Way is dedicated to mobilizing businesses, community leaders, individual donors, and nonprofit organizations to help people lead better lives in 4 key ways: helping children succeed in school, helping financially struggling families, and older adults and people with disabilities, helping them live as safely and independently and fully in community as possible. So we're very proud to do this work through numerous volunteers throughout our region, and United Way of Southwestern Pennsylvania serves 5 counties. You mentioned some of them a moment ago, but Allegheny, Butler, Westmoreland, Fayette, and Armstrong counties.
Well, and I remember that not too many years ago, there was a United Way of Allegheny County, and that was that. How has the larger geographic footprint for the United Way been an advantage to you in meeting the needs of the people of the region?
Yeah. So at our core, United Way is what I call a Main Street organization, a very local organization, understanding needs and really trying to leverage partnerships and community to solve those problems and to help people lead better lives. But having thousands of United Ways across the country isn't particularly efficient and effective as we would like them to be. And so by combining the smaller United Ways into a regional United Way, we've been able to tap into additional capacity in terms of volunteers and staff to be able to share resources, innovate in better ways, and spread those innovations, programmatic innovations, across the region. So it's really benefited to be able to maintain that local flavor of United Way and that local focus, but tap into the broader resource network.
Well, and I assume that the list of priorities that you shared a moment ago focuses on problems that exist, whether you're in an urban area or a suburban area or a rural area of the region.
Certainly, we see the same types of challenges across the region, but how we choose to address them can be a little bit different from community to community. And that's what this merger and this consolidation of our regional United Way has allowed us to do, to really understand and respect how the needs play out in the local community and how we address those, and yet still have the capacity to operate and tap into the broader network of United Way.
And it would seem that you're a perfect person to lead those efforts, since you had extensive experience with the United Way of Westmoreland County, which included other counties as well. And now you're here in Pittsburgh.
I kind of joke with some of my colleagues that I think I've been through more United Way mergers than any other United Way CEO, because I was involved with merging Fayette into Westmoreland prior to the merger with Allegheny, and then Butler County actually merged in after the initial merger with Westmoreland. So I've been to this rodeo a few times, and I think what really the success hinges upon having trust and belief that local input and local participation will continue within the organization. And that's what we've done. And I think that's why we've been successful.
Is the United Way a direct provider of services, or is it a funder of other organizations that provide services, or both?
So it is both. It's a little bit of both. United Way of Southwestern Pennsylvania works with about 100 different human service organizations throughout the region to deliver on those priorities, to solve the problems of helping kids succeed in families and older adults and people with disabilities. But United Way also, in addition to raising dollars to support those types of programs through our partner agencies, we fund, for instance, and operate 211, which is a 24-hour, 7-day-a-week, 365-day-a-year helpline that we are able to take calls and texts and chats and web self-service from individuals in the community who are looking for help. And that's something that is centrally run through our United Way.
I thought I knew the United Way. And I did chair one of the big campaign drives a few years ago, and certainly I knew about 211, but I did not know that was operated by the United Way of Southwestern Pennsylvania. What kinds of help do people look for when they make a call on that line?
About 75% of individuals who contact the 211 helpline are looking for help with basic needs. They're struggling to access food, to pay the rent, to make sure that their utilities stay on. So that is the bulk of our calls, regardless of what's happening in the economy or the pandemic. So we see a lot of basic needs calls, but we also see calls for I'd like to volunteer, or I need support for an older adult relative. How can I tap into some of those services? And then most recently, and in particular over the last 8 months, people have been calling for just trusted source of information around the pandemic. Where can I get tested? Is it safe for me to ride the bus? How can I, should my child go to school? And so we've worked really closely with the health department, with the Department of Human Services, to make sure that we have the most accurate, up-to-date information to share with people when they call us as well.
Of course, I don't have access to the 211 calls, but I did see on your website that you have a feature that permits a person to send in a question or a plea for help. And just to give a kind of human flavor to some of these requests, I wrote a couple of them down. One said, "I'm pregnant and do not work. My husband makes $500 over the poverty line. I have a 2-year-old and a 9-year-old to feed and clothe. Are there any agencies or food banks that can help me?" And another one said, "My husband has cancer. Is there any way you guys can help? We are in so much financial need that we are having trouble making ends meet. And you know, when you hear those words, you can kind of, in your mind, see people who are in a spot where they do need help. And I think this 211 is so great because there often is discussion of the growing economic divide in this country. But I do think there is a growing divide too between people who somehow know how to get things done and know where the resources are and know who to call, and those who really do need a helping hand. And you handle a large volume of calls on 211, don't you?
We do. And last year we handled over 120,000 contacts. And I think another really important point about this, Mark, that I want to share is that when people contact us at 211, it's generally for more than one need. So you can imagine if you're struggling to get food, that you're probably struggling to pay rent, utilities, maybe have some issues around childcare. And some of the contacts, some of the calls can be 20 and 30 minutes in length. And that's what we've been seeing lately, that those call lengths have been much longer because people's issues and problems are more complicated right now.
There's another outreach program that I noticed looking at your website that seems critically important at this time when people, to preserve their own health, are distancing from others. And you also are supporting a check-in service of some kind, aren't you?
Yes, yes. So we, as I mentioned, one of our central areas of focus is supporting older adults and people with disabilities. And folks who are more vulnerable to the virus during the pandemic are staying closer to home by necessity. And we want to make sure that social isolation can be minimized as much as possible, but also to understand what needs aren't being met. Folks who, I know this with my own parents, who are generally healthy but have been staying much closer to home, were really concerned about going out and getting their own groceries. So just checking in with people, understanding, are they making human connection? Do they need groceries? Do they need medicines? And then making sure that we get those items to them if they are in need, or just simply check in and say hello and let them know that somebody's thinking about them.
So let me switch for a moment to the other role that I mentioned, that is the United Way as a funder of other organizations that are meeting direct needs of people within the community. I know that the United Way has been around, as you said, for more than a century. Why is it that an individual donor might choose to make a donation to the United Way rather than making a direct contribution to another agency?
I would give several important answers to that. The first being that we really have this 30,000-foot level view of human service needs, and that's really what our critical focus is. So we make a distinct effort to understand what the needs are, know which partners in the community who are working on those needs, also monitoring the effectiveness of that investment. So we're very careful. We review significantly prior to making grants and then are in constant contact and ensuring that those dollars are being efficiently and effectively invested in the community. Then the final thing that I would say is that it's easy to make multiple contributions and know that you're supporting many elements of need in the community through and with United Way.
It won't surprise you when I say that I tend to think about life more in terms of the passage of academic years than calendar years. And I have to say that the 2019-2020 academic year really got off to a roaring start for you. In the summer of 2019, you were selected to serve as the president and CEO of the United Way of Southwestern Pennsylvania, a very important and very visible position within the community. And you were a pioneer. You were the first woman selected to serve in that role. Then early in 2020, the Pittsburgh Business Times selected you as a woman of influence. And that's when things started to go bad. I don't know if there's anything equivalent to the Sports Illustrated cover jinx, but I think that your selection was announced on March 10th. And 3 or 4 days later, we were in a pandemic lockdown. How did you come to first know that the pandemic was going to be a source of major problems for the country, and more importantly, given your role for the region and the people of the region?
Well, because 211 really also always mobilizes to rise to the occasion in crisis, we were actually talking about the potential impact of the pandemic at the end of 2019 and early 2020 about how we could respond and how we could support the community if the pandemic significantly impacted us. You know, in January, I was hoping that those plans were all for naught and that, you know, we were mobilizing just in case, but we wouldn't need to. So we were a couple of months ahead of what was actually transpiring in the community, getting ready at 211, reaching out to all of the local governments in the communities, counties that we served, reaching out to the health department and the Department of Human Services. And, you know, when we reached out to the county and we said, we're here, we're ready to mobilize if you need us. And they said, that's so nice of you, United Way. We're not sure that, you know, we'll need you at all. We sent everybody home on March 13th from our office, and Saturday morning, March 14th, I got a call from the county saying, we could really use your help at 211. We're being overwhelmed by calls at the poison control line. So what it did is it spurred on this partnership between the health department and United Way and the Department of Human Services to really be that front door for all the calls. And really back in March, none of us really knew what was happening, whether or not it was safe to go to work, whether or not we should be sending our kids to school, when school might reopen. So we immediately took double the call volume. We mobilized within 24 hours and then started taking those calls from the health department. And really ever since that time, we've been serving as, you know, trying to be the front door for a reliable source of information and have partnered throughout the region to be able to do that.
What is it that led you to be thinking about the pandemic and its possible impact late in 2019, and to be going through planning exercises that you hoped you'd never have to implement?
Yeah. Just knowing that, and we've seen it demonstrated throughout the pandemic, that people need to have a place to go for information, and people need to have a place to go when needs arise. And so the first couple of weeks when we were taking calls at 211, it was all around health questions that the health department was helping us answer, obviously. But it quickly shifted to the economic crisis. And how do I get help with, and specifically with food? People were immediately being laid off in droves and concerned about feeding their families. And kids weren't in school, which is a primary source of food security. So kids were out of school, family members were being laid off. And so we knew earlier in the year that if this would become a significant issue in our community, people would be suffering and they would need help meeting their basic needs. And so that's why we plan early. And we're glad that we did, but we wish that it didn't come to pass that we were needed in this way.
And what you have said in the last few minutes includes mention of the county health department, the Department of Human Services, schools. Whether we're dealing with a pandemic or whether we're meeting with the ever-present needs of neighbors in the community who are disadvantaged, whose responsibility is it to respond to those needs?
Well, honestly, it's everyone's responsibility. And what has been so amazing throughout this pandemic is that, United Way has worked with so many partners, foundation partners, public officials, public agencies, nonprofit organizations, donors, and corporations. And we all have something that we can bring to bear, whether it's, connections and resources and money or volunteer time, or just the intellectual capacity to engage in the problem solving. And so we all have a potential role to play. And I've seen that happen over and over again in this community over the last 8 months. It's been incredible to be a part of that.
Well, one of your hallmarks in terms of your leadership we've already discussed, and that is your belief in the power of preparing to deal with problems on a regional basis, because these problems do not respect kind of boundary lines between counties or between municipalities. And you also seem to be a real champion of cross-sectoral solutions to problems and partnerships to dealing with challenges. Am I capturing that accurately?
Yeah, absolutely. That, all of the organizations that I mentioned have particular strengths and abilities to lend to the solution. And we were, at United Way looking at where's our superpower to be able to contribute to recovery in the community. And early on, it was clear that 211 was a big part of that superpower. But another really big part of that superpower was the connective tissue that we are with corporations and foundations and nonprofit organizations and donors and volunteers in the community. So early on, volunteers were needed, and we partnered with the Greater Pittsburgh Community Food Bank because they were needing volunteers, and we were trying to make those connections for them as well to help address that need. So that's really what our focus has been, making sure that we're contributing in the ways that illustrate the skills and the tools and the toolbox that we have.
Well, and of course, you did mention the foundation community, and Pittsburgh is blessed to have foundation community that is disproportionate in terms of resources to the size of the community. And I know that it always made me feel good if I picked up the newspaper and saw that the United Way was partnering with members of the foundation community. You referred to the connective tissue. Do you think that this region is particularly good at this kind of cross-sectoral partnering or not?
I think we're pretty good at it. I think where we have room to grow is across the region. And it's one of the reasons why I've been such a champion of United Ways partnering across the region, so that we have a better appreciation of how needs and issues play out from urban, suburban, rural. And I think that's the piece that we have some work to do on yet. But I think that we've made some significant progress during these last 8 months as well, working across those traditional boundaries.
And I will say that's a part of the challenge with respect to which the Institute would really like to be involved too, because we have studied the different approaches that are required if you're going to meet the needs of people in poverty, in urban areas, in suburban areas, and in rural areas, because being in poverty is not good in any geographic setting. But what you need to do to help address those problems can be quite different.
Sure thing. Yeah, we work to, for instance, fund some of the learning hubs right now in the urban area. And, some of those programs just simply don't work out in Derry, Westmoreland County. And so we have to deliver services in a different manner.
And to go back to the partnering possibilities, one of the issues that I see is the fact that some of the entities that would normally be standing shoulder to shoulder with you to address these problems are suffering themselves. We see that in municipalities that have as a basic function delivering services. And we saw just recently the chief financial officer and mayor of the city of Pittsburgh saying that they're facing a budget deficit that could lead to more than 600 layoffs. All of a sudden, not only are they less well positioned to help, but you've got 600 families that have lost a principal source of income and may be looking to you for help. And I know that the nonprofit community too has really been squeezed both by revenue losses and by increases in the demand for services. Is that what you're seeing too?
We are, at a time that human services are being called upon, agencies are being called upon to respond to, over 2 million Pennsylvanians applied for unemployment. We've seen several industries really decimated during the pandemic. People are in great need and are turning to human service agencies who are suffering revenue declines. We partnered with the Pittsburgh Foundation and the Pennsylvania Association of Nonprofit Organizations to do an analysis of what that revenue loss was. And it was, over $700 million from 8% of the nonprofit universe in Pennsylvania. So the loss is significant. And then we add on to that the state budget situation is really dire. And the state legislature has to revisit that by the end of this month of November to determine how they're going to close a $5 billion gap in the state budget. So we are anticipating that there may be budget cuts for human service agencies, and philanthropy just cannot fill those gaps. And we're going to be seeing some pressure to either reduce services, cut staff at a time that we need these organizations the most.
Is there a way that you can describe just how devastating the impact of this crisis has been on the people of our home region, and why it is it may not be a crisis, it may be a series of crises that make the challenges that you're facing more daunting than almost anything that has come our way?
Yeah, I really have been talking about this as a triple crisis. One that started off as a pandemic, a health crisis which persists, which then precipitated an extreme economic crisis where a couple of million Pennsylvanians and millions of Americans lost their jobs. That has created all of this stress on families, and then in addition to that, this is not it's disproportionately impacting our communities of color, and then our crisis of racial equity and social justice at the same time. And so it's really been trying to address multiple layers of crisis in our community. So that's really the first thing. But United Way early on as well decided that we also needed to be keeping a close eye on how this was all unfolding. And so we've actually been putting together, again in partnership with others in the community, Allies for Children and the Poise Foundation, what we're calling the Community Pulse Report, which is monitoring how these needs are changing and shifting as we move through this period in history. And a couple of things are really, really striking to me is that it's estimated by the end of this calendar year that 23% of children in Allegheny County alone will be food insecure. So that's almost 100,000 children. I've also read that more children are food insecure in our country now than ever before in recorded history. And so that is just so deeply, deeply troubling that this is the current circumstance. And so I draw out that one piece, but there are so many elements of this Pulse report that we're following that are really reflective of what's happening in the community right now, across education, across financial stability, across what's happening with food security. So I would say that there are just multiple layers to this.
Well, and that one example that you cited really does give a human face to the numbers. I mean, thinking about 100,000 children in this region not getting the food they need. It's hard to imagine and hard for you, I know, to accept. How do you feel about the near-term future, the next 6 to 9 months? You've already made reference to the state budget and the work that's going to have to be done on that in the very near term. So how do you feel, and are there policies that are in play, potential policies in either the state or the federal governmental level that you think could make a difference?
Yeah, certainly, minimizing the impact at the state budget level would be really important. We know that the stimulus packages have not proceeded apace on the federal level, which are really important for support for state and municipal governments as well. If there's not stimulus, you already referenced what might happen at the city of Pittsburgh level. There have been eviction moratoriums and utility moratoriums, which have been lifted to some extent. We could see thousands of people being evicted from their homes if these moratoriums are completely lifted. And that's of deep, deep concern to us. Making sure that people are safely housed and have their basic needs met is really what we've been focused on over these last 8 months. And if some of the governmental policies to ensure that don't stay in place, that would be deeply troubling to us going forward. Also, we've been pretty fortunate at United Way that a lot of our donors and contributors have stood up and been generous during this time. But there is some concern about the long haul nature of this recovery, about what might happen if the economy is slow to recover, what might happen in philanthropy to be able to do our part in the way that we want to.
Well, and when you think about nonprofits and their struggles, we all know that throughout the region there are important organizations that are struggling because their business model really depends upon paying clients. The museums are an example. The organizations that are a part of the cultural trust are an example. The aviary would be another example. I assume FIPS is an example. You're not in that position, but you are directly dependent upon the support of donors during a time of increased demand.
Yes, exactly. We rely, 75% of the dollars that United Way raises is through corporate and company campaigns, corporate contributions and company campaigns. Well, we're experiencing, while unemployment has come down, we still have about 8% unemployment in the region. And that means that some of our donors are now some of the folks who might need our services. And so that will put some pressure on us as well to be able to continue providing the level of service that we would like.
Well, I helped lead a lot of University of Pittsburgh campaigns, which were important to you because we're a big employer and we do have the kind of traditional campaign to which you just referred. And I did note this year that when the messages came out to the members of the university community, they were asking that people consider making a larger contribution this year. And I guess put in the most simple terms, it could be said, well, the people who still have jobs ought to be thinking about the people who don't. I'd like to go back, if I can, to two headlines that accompanied articles trumpeting the appointment of Bobbi Watt Geer as the president and CEO of the United Way. The first said, as charitable giving nationally wobbles, Bobbi Watt Geer named to lead United Way of Southwestern Pennsylvania. And I just want to focus on that language about charitable giving wobbling, because this country has long been known for the generosity of its people, which has fueled what really is a distinctive commitment to philanthropy in the United States of America that you don't see in many other places. But we have been moving through times when people have questioned with reason, are we abandoning some of our traditional values? Has the commitment to reach out and help neighbors in need, in your judgment, been lost in American society?
Yeah, I think that's a multi-layered question. And gosh, I wish I could have written the headline, because I kind of reacted to it as well when I read it. So the reality is that, we have seen increases in charitable giving, but we've also seen some segments of our society step back from charitable giving, most notably middle class Americans. And I think some of that really does point to the erosion of the middle class. But since 2000, we've seen like a 50% reduction in those who earn less than $100,000 a year giving to a charitable organization. But at the same time, we've seen a 25% increase in those who earn more than $100,000 a year contributing to charitable organizations. So I think it's a tale of two stories here in terms of who's giving and how they're giving. But from the United Way perspective, we have seen modest increases in our giving year over year for several years. So I think it points to the generosity of this region. But there certainly are some challenges when traditionally we work with employees of companies throughout the region, and we're seeing fewer of those middle income Americans contributing. So that's something that is certainly a concern for us.
Do you trace any of that fall off to the changes in the tax code that increased the standard deduction, and for a big slice of the population really reduced the value of the charitable giving deduction?
So those changes are relatively recent, and I'd like to see a little bit more trend line before making a judgment on that. I do think that it'll probably have some impact. It is an incentive, and a lot of folks who itemized in the past no longer itemize, and it does make it less appealing if you're looking for that tax deduction. But I just don't think we have enough trend line yet to say whether or not and to what extent that tax policy has had on charitable giving.
Well, you said you wished you'd have been able to write the headline for the article that had the word wobbling in it. You may like this second headline better because it described you as, I think this is a self-description actually, being a daredevil at heart. And given the way the year has unfolded, people might say that just by accepting this position, you were something of a daredevil, but I gather that's not what you were. You had in mind when you used that term.
No, not necessarily, but it's a good thing I have practice being turned upside down and inside out, because it has been that kind of a year.
Well, so what makes you a daredevil?
I've always enjoyed pushing the limits a little bit, and some people might find that a little surprising because I tend to be low key, but have just always really enjoyed trying to experience new things and trying new experiences, and it's just I find it really enjoyable, and I think it pushes your thinking and ability to manage in certain situations if you're not afraid to try something new.
Well, what really caught my eye was, I think, the most recent daredevil example that was in that article, which was kayaking on Lake Superior, because I grew up on a hill overlooking Lake Superior. And I know that it's almost as big as an ocean. The water is deep, the water is cold. It takes some courage and some skill to get out on that lake, which is often rough in a kayak too. And we're glad that you have taken those traits, the skill and the courage, and applied them for such an extended period and so effectively to improve the quality of life for people here in Southwestern Pennsylvania. And certainly everybody has got to be pulling for you and all of your partners as you try to address the challenges that are facing the region today.
Well, I thank you for that. And it really is an honor and a privilege to do this work in this community. I couldn't have dreamed of something that I would rather be doing. And as challenging as it has been, it is so meaningful. And I get to work with fantastic partners in the community.
Well, we probably should thank you for this time and let you get back to work. So thank you very much, and good luck with all of your important work.
Thank you very much. It was good to be with you.